Hey guys, thank you so much for joining me today. The title of today's talk is Mold Matters, Unmasking the Hidden Epidemic. And that's exactly what we're going to do. Because let's be honest, mold related illness is one of the most overlooked, underdiagnosed, and life disrupting root causes of chronic symptoms that I see in my practice. It hides in plain sight, and it's far more common than most people or even most doctors realize. Now, we're not just talking about a little sniffle or seasonal allergy here. We're talking about mycotoxins, toxic compounds released by certain molds that can hijack your immune system, disrupt your hormones, damage mitochondria, and inflame your brain. And here's the tricky part: it can mimic almost anything: fatigue, brain fog, anxiety, hormonal imbalances, autoimmunity, neurological issues, chronic pain. You name it, mold can play a role. What makes this so frustrating is that most people suffering from mold related illness go from doctor to doctor, from specialist to specialist. They spend years, literally years, running tests, getting vague labels, and too often are being told that it's all in their head. Well, I'm here to tell you it's not always in your head. It can be in your environment. And when you understand how to find it, fix it, and detox it, your body can heal in ways that you never dreamed possible. In today's session, I'm going to share some of the most practical, eye opening data you'll ever hear on this topic of mold related illness. We're going to talk about how to spot the hidden red flags of mold exposure in your home and in your body, the difference between inhaled mycotoxins and those from food, and why the inhaled type is so much more dangerous, the connection between mold, mast cell activation, and chronic gut issues like SIBO or Candida, and most importantly, the exact steps you can take to get your body out of this survival mode and back to the state of healing. So stick with me. This conversation could completely change the way you look at your health and maybe even your house and home. So let's dive in and get started. So mycotoxins are toxic compounds naturally produced by certain types of mold. These toxins can significantly impair human health, especially when exposure is chronic or if you are a genetically susceptible person. They're lipophilic, heat stable, and easily aerosolized. Common indoor culprits include Stachybotrys, Aspergillus, Penicillium. Those are a few you may have heard of. And exposure typically occurs through inhalation, ingestion, or contact with the skin. When you're thinking mycotoxins, you want to think of damp basements, water damaged drywall, contaminated grains, or even coffee beans. It can come from foods. A lot of people don't think about that. I like to view mycotoxins not as an isolated toxin, but as a complex physiological stressor affecting every system, including your immune system, your endocrine system, especially your nervous system, and obviously your mitochondria. So why should we care? What is the big deal with molds? Well, data from the EPA and FEMA show that approximately 50% of US homes and 85% of commercial buildings have some sort of water damage. And added increasing humidity, the fact that a lot of buildings now are built extremely tight. And another thing is a lot of people are working from home now, which is leading to a significant rise in exposure. It's been a problem for a long time, and now it seems to be just getting worse. Insurers pay about $3 billion per year on mold claims. And researchers estimate that up to 10 million Americans presently meet criteria for chronic inflammatory response syndrome, yet only 5% of people receive a correct diagnosis. And these are the patients we tend to see in the clinic, where they're being told that, hey, everything's normal, your labs are fine, there's nothing wrong with you, or even worse, it's in your head, or you're depressed or anxious. Clinical presentation is very complex and it's extremely confusing because no two patients look alike. Classic symptoms would be the unrelenting fatigue, cognitive dysfunction, brain fog, headache, sinus congestion, cough, shortness of breath. Some people will get static shocks or unusual electrical sensitivities. Systemic symptoms may be unexplained weight changes, POTS-like dysautonomia, where people will get palpitations and tachycardia, weakness, dizziness. Hormonal irregularities are very common, numbness and tingling in the limbs, and non-restorative sleep, all very common with mycotoxin illness. But again, these are just a few of the many symptoms people experience. One of the things that's important to remember about mycotoxins is that, genes load the gun and the environment pulls the trigger, right? Just as the same with autoimmunity, with chronic infections, the list goes on and on. Genetics are important, but they're not the whole picture. It's estimated that 25% of the population in the United States carries HLA-DR and DQ haplotypes, which are genetics that reduce your ability to bind biotoxins and impairs your ability to clear them efficiently. Then you add in different problems like methylation, SNPs, MTHFR, many of you are familiar with that, NRF2 polymorphisms, and glutathione transferase variants. And you have the perfect storm for chronic illness after an exposure where other people can tolerate them. There are a variety of conditions that are important to consider and to know have been associated with mold-related illness. And the list isn't small, but I just wanted to give you some ideas on some of them. Neurological, this is a big one. We see a lot of people are diagnosed with, chronic fatigue syndrome, fibromyalgia, MS-like syndrome. So, where you don't have a positive, you don't have in your CSF, you don't have the traditional signs on an MRI, but you have a lot of the symptoms. PANS, PANDAS, migraines, obviously the brain fog, cognitive impairment, depression, anxiety, ADHD, and then Parkinson-like. Anytime they say like or idiopathic, you got to be very suspicious that you probably are not part of that diagnosis. Respiratory, asthma, chronic sinusitis, reactive airway disease, pneumonitis, and then bronchitis and chronic cough. All those are very common with mold exposure. When it comes to immune and autoimmune, it's been linked to, obviously chronic inflammatory response syndrome, autoimmune disorders like Graves' disease, Hashimoto's, rheumatoid arthritis like symptoms, again, where you don't fit that classic box of having the traditional markers, lupus like symptoms. And then, we know that mold, again, will cause weird immune system things to happen. And that's where we have to be very suspicious when we're getting these diagnoses. IBS, leaky gut, food sensitivities, nausea, vomiting, diarrhea, SIBO, candida. These can all be connected with mold. And one of the ways your body gets rid of mold, as we'll learn in a little bit, is through the gut. So a lot of people have digestive issues when they have mold complications. And then cardiovascular, renal, hypertension, cardiomyopathy, nephrotoxicity, high cholesterol. This can be signs of mold complications. And then, of course, many of you know that certain mycotoxins and molds are associated with different cancers. So, these are serious things that need to be considered. And when you get a diagnosis, you got to think about why. Hives, eczema, rashes, dermatitis, mast cell activation, histamine intolerance. These are all things that make me think about mold. Same with reproduction. If you have problems with infertility, miscarriage, birth defects, and those are all pretty common with mold. And then early puberty or hormonal disruption in children, another problem with mold. Because presentations mimic other disorders, patients are often told that they have primary depression or anxiety, IBS, or, even worse, it's all in your head. Studies from the Mold Illness Research Center show that the average diagnostic delay is 7 years and over 10 practitioners before people figure out that mold is part of the equation. So recognizing patterns, especially multi-system, multi-symptom causes that defy the standard labs, is critical for early intervention. And this is the common experience for people who struggle with environmental illness and many other illnesses that don't fit inside of the box. They go to their doctor, they get their labs drawn, they say, good news, your labs look great. You're perfectly normal. You're the picture of health. And while you're feeling like crap or, obvious things are going on. So what's the difference between mold, spores, and mycotoxins? Well, the truth is that both can be really problematic. Mold spores are the seeds. Mycotoxins are the chemical warfare. Spores are particulate and can trigger allergic or infectious responses. HEPA filtration removes many of these spores, but mycotoxins are teeny tiny molecules that off-gas from fragments of mold and persist even after the visible mold is gone. They can penetrate skin and olfactory nerve pathways, and they can even bypass the blood-brain barrier, which is where a lot of that
neurotoxicity comes into play. One of the biggest challenges with mold illness is that people often don't realize their environment is a part of the problem. Mold doesn't always show up as black spots on the wall or a horrific musty smell. It can be much more subtle, and that's really important to understand. Here are some of the red flags. I just want to give you some red flags that may clue you in that mold could be a problem. If you've had water damage in the past or present, you need to think about mold, because even a leak that was taken care of, quote unquote, many years ago can still be a problem if the materials weren't fully dried or replaced. Musty or earthy odors, this is a common one, especially in these New England basements. That is a sign of mold. Condensation in the windows or HVAC systems, high humidity, especially in the summer months, in the basements or the bathroom, that is a red flag. Warped or discolored walls, ceilings, flooring, not a good sign. And then one of the things I always listen to that's important, like some people, when they have mold issues, they actually feel better when they go on vacation, which can be a little bit tricky because there's other stressors involved usually when you're going on vacation, or relief of stressors. But a lot of these people will go on vacation, and after a few days they notice, hey, I'm not having the same symptoms that I was having before. That's something that you want to clue into. That might be environmental. Multiple people in the same house or same space dealing with similar issues, fatigue, sinus issues, headaches, or even irritability. And then a history of flooding, roof leaks, plumbing issues, poorly ventilated, energy sealed buildings. That's another big thing we're seeing. A lot of these houses are just extremely tight, leaving more room for mold to grow. And even, if your house is new, you're not immune to the fact that mold could be a problem. New construction, you can get water in the house during the construction. Again, with everything being tight, that's the perfect environment for mold to grow. HVAC systems are notorious for being problematic. If any of these red flags sound similar, it doesn't necessarily mean that your space is dangerous, but it's worth digging deeper into, because it could be a problem over time. Even medicine has already exploited the power of mycotoxins. So it's funny to me that we recognize that these mycotoxins are extremely powerful, but nobody's looking. Some of these names may sound familiar. Cyclosporine is a medication that is used for organ transplants. It's been very effective at suppressing the immune system to prevent rejection. Even the first statin, mevastatin, was isolated from penicillium. So, and there's several others you can see in this chart. These are examples, again, that underscore how potent these molecules modulate human immunity, lipid metabolism, and mitochondrial health. So we really got to understand that, a little bit of mold can cause big problems, especially if you're genetically susceptible. The very first and most important step in addressing mold-related illness is identifying that it's actually part of the picture, and that really begins with a detailed history. It's as important as testing is. One of the most powerful tools that we have is simply asking the right questions and listening to a story closely. And that's why, in that first visit that we typically have in our programs, we're really diving into your story, because that's extremely helpful. When I'm working with someone who might be dealing with mold or mycotoxins, I'm looking for specific clues. Like, again, have you lived or worked in a water damaged building? Even if it was years ago, it can still be a problem. Do you feel better when you leave or go to a certain different environment, like when you travel or you spend time outside your house? So your symptoms multi-systematic and unexplained, like fatigue, brain fog, anxiety, gut issues, light sensitivity, or chemical intolerance? Have you been diagnosed with certain things like fatigue, fibromyalgia, POTS, MCAS, or Lyme, but the treatments just don't work like you would expect them to? And do you have family members that react to your environment, maybe fragrances, or do even supplements bother you more than they should? These are some of the many red flags that we think about when we're dealing with mold. Anything that's bizarre and doesn't fit inside of a box, you got to think outside of the box. Another great next step when we're considering mold is a non-invasive tool called the VCS test, or visual contrast sensitivity test. This is something that you can do at home. You just Google vcsscreen.com, it'll pop up. What this is it measures your ability to detect subtle differences in shades of gray, which can be impaired when you are impacted by neurotoxins, especially ones that are produced by mold. While it's not a definitive diagnostic tool on its own, a failed VCS test can be really helpful to clue in on the fact that a biotoxin or mold may be part of the equation. So if you pass this test, it's usually a pretty good you get a pretty good idea that mold is not part of the equation. But if you fail it, it doesn't mean that mold's an issue, but it definitely tells me we want to take some next steps. It's quick, it's inexpensive, and alongside history and other lab testing that we're going to talk about, it can give us a much clearer presentation of what's going on. One of the best tools we have in detecting mycotoxins or mold exposure that many clinicians and patients just don't even know about is a urine mycotoxin test. I had someone just the other day, so they asked their doctor for a mycotoxin test, and they said, well, that doesn't exist. So that wasn't very helpful and didn't get them anywhere, but we were able to hook them up. This test specifically looks for the presence of specific mold toxins like ochratoxin, aflatoxin, gliotoxin, and there's several others it evaluates as well. While what we're measuring is what your body is actually excreting. So if you've recently been exposed or are actively detoxifying, we're going to be more likely to catch it. And that's why we often prime the system before testing. So in many cases, we'll recommend people take liposomal glutathione, which is a powerful detoxification support, for about a week before doing this test. And this helps just mobilize some of those stored mycotoxins out so we can catch them in the urine. A positive test means that your body is offloading toxins, which can validate exposure and guide treatment. A negative test, though, doesn't always mean you're in the clear, because if your detox pathways aren't opened up or are sluggish or are blocked, these guys may not come out in the urine. So it's a good test, but as with any test, it's not perfect. When it comes to environmental testing, one of the most acceptable places to start is with mold plates. I'm a big fan of mold plates. We typically recommend a company called Immunolytics. They've got a package where you can buy the plates and do the test, and then do a quick consult to figure out if mold may be a problem for you. These are simple, affordable, gravity settle plates that collect the mold spores from the air in your home. You place them in different rooms. You turn on your HVAC system. You let the air circulate for a couple of hours, and then you send it back you close it up, let it grow for 4 or 5 days. If you see things bubbling up, you send it back to the lab for analysis. Just because mold grows doesn't mean that it's a problematic mold. Mold is everywhere, but they can do the testing to figure out if it is problematic or not. They can give you a lot of guidance from there. While these plates don't detect hidden mold behind walls or in the HVAC systems, they can pick up on actively growing mold in the air, which is often enough to raise a red flag to justify further inspection. This is a great first step if you're not ready to invest in more advanced testing on your home, or have an inspector come in, or you really just want some more accurate confirmation. And the other beauty of these mold plates is when you label them on which room you're in, so you know when you do get a mold inspector where they should be putting a lot more attention. For a more detailed look at the environment, we often recommend ERMI testing, which stands for Environmental Relative Mold Index. This uses DNA analysis to detect and quantify mold fragments from dust samples collected in your home. It's a simple dust collection, like a Swiffer. It compares your sample to a database of water damaged building and gives you a score that helps you assess your overall mold burden. What I like about the ERMI is that it can detect both living and dead mold, including species that no longer are actively growing, but still may be releasing toxins. That's a real thing. It's more important. It's more sensitive than the plates and gives us a clearer picture of long-term exposure. But with that said, ERMI is best used, again, alongside inspection and clinical judgment. Nothing is good by itself, or else we would just be doing that. The bottom line is, if you're suspicious that your environment is contributing to your symptoms, an ERMI can help you confirm or rule out this problem with more precision. One of the most critical and often overlooked steps in recovering from mold illness is having your environment properly evaluated by a qualified mold inspector, also known as an IEP, indoor environmental professional. Now, this is something to remember and keep track of. There's not many of these people around, especially in New England. There are a couple that I'm aware of, but this is essential. Many standard inspectors just do a quick walkthrough, maybe a moisture reading, and call it good. They might completely miss hidden mold or downplay the significance of your symptoms. That's why I strongly recommend working with someone who's trained through organizations like ICEA, the International Society of Environmental Acquired Illness. So this society, what they do is they train IEPs who are going to be more familiar with the health implications of mycotoxin exposure. They know where to look, they know how to test appropriately, and more importantly, they know how to interpret the results through a health lens, not just a structural one. If you're dealing with chronic symptoms and you suspect mold may be involved, bringing in a skilled IEP can really make or break your recovery. They're trained to dig deeper, checking behind the walls, like I said, inspecting HVAC systems, identifying for hidden sources that oftentimes get overlooked. This isn't a place to cut corners. I've seen that happen. You can do all the detoxing in the world, but if your environment is still making you sick, you're not going to fully get better. Getting the right eyes on your home is a foundational step. Now, once you have identified that mold is a problem, the next step is remediation. But it's again absolutely critical that the person who does the inspection is not the same person who's doing the remediation. And I know that might be common sense to people, but those guys are out there. The reason is this is obviously a conflict of interest. If someone stands to profit from cleanup, they may be more likely to either overstate the problem or miss things that don't suit their bottom line. A good IEP inspector provides an objective, unbiased assessment of your space. They write a detailed recommendation plan and hand it off to a separate remediation team who follows the protocol. Once remediation is complete, the IEP comes back to verify that the work was done thoroughly and that the space is safe. The check and balance system here, protects you, the patient, and ensures the remediation is done the first time because it can be expensive. When hiring a remediator, look for companies with experience in sensitive, health compromised clients, ideally those familiar with ICEA protocols or that work closely with these IEPs. And your IEP will give you recommendations. Poor remediation can make things worse by releasing more spores and mycotoxins in the air. Done right, it can be a powerful step forward. Done wrong, it will be a major setback. And I know, I've heard of this, we see this all the time. The urge for DIY cleanup is extremely strong, especially to save time and money. But if you or your family are extremely sick, it's almost never worth the risk. Disturbing mold without the proper containment can aerosolize spores and mycotoxin, making everything worse. Sometimes you can do small fixes and your IEP can guide you into what's appropriate. But when it comes to your health, this isn't a time to guess. Don't take those shortcuts. I've seen it be problematic time and time again. So what do you do with all the items in your home that have been exposed to the mycotoxins if mycotoxins are an issue? You can't just burn your house, but at the same time, you want to be strategic about this because if you leave things that have been exposed in your home and they haven't been properly cleaned, then it's going to make you sick again. It's that simple. One of the toughest parts of dealing with mold illness is just deciding what stays and what goes. And again, the IEP can be helpful for this. And the ICEA guidelines are really clear and helpful, and they've got a lot of great resources online that you can look at. But the reality is porous items, things like upholstered furniture, mattresses, paper goods, rugs, clothing, stored in moldy areas can all hold on to spores and mycotoxins even after the remediation. These are usually the first things we recommend letting go of if they've been in a contaminated space. Now, on the flip side, non-porous items like glass, metal, hard plastics, sealed wood, these are all generally safe if you clean them appropriately. Semi-porous items like leather, unfurnished wood, or electronics are kind of a gray area. And it really depends on your situation, where the exposure is, how sick you are. Some may be salvageable with the proper cleaning, but if they're in a high exposure area and you're highly sensitive, they could still trigger symptoms. And this is where, again, your IEP's guidance is going to be essential. They can help you prioritize what's safe and what needs decontamination and what you just really should let go of. I know it's extremely overwhelming, but your health is worth more than a couch or a book or any sweater. So just be really careful here. And then, like I mentioned, go to their website. They've got a ton of really great resources. This is typically who we utilize for guidelines on mold remediation and testing. A lot of what I'm talking about now is from these guys here. They're a great resource. And then another great option once remediation is complete is called a fogging system. And I personally have one of these. We just did our building. And so what this is, this is something from a company called Fog Haven. Fog Haven is a plant-based non-toxic fogging solution designed to bind and neutralize mold spores, mycotoxins, and other contaminants on the surface and in the air. The fogger works by reaching areas that are typically missed through cleaning. It gets in the cracks, the soft furnishings, the ventilation systems. It doesn't replace remediation or air filtration, but it can be a great final step to reduce biotoxin load in a home. It's really useful if you're extremely sensitive or dealing with cross-contamination from belongings that can't be easily washed or replaced. Just make sure, again, your home has already been remediated before you do this, because fogging in an active mold problem won't solve it. It's meant to supplement, not substitute a thorough cleanup. The other thing that you want to do with this, because literally you can't see when you do this, the fog, you can't see 5 inches in front of you. It is thick, which is awesome, but you got to take your smoke detectors out. I made that mistake myself when I did ours, and everything went off and people thought the place was burning. But great tool. And again, all natural oils to help with that. Once you've addressed the mold source too, improving air quality, indoor air quality becomes crucial. And that's a great thing to consider. Mold spores, fragments, and mycotoxins can linger in the air and the dust and really, again, can cause continuous symptoms. A strong purifier helps reduce your exposure, creating a clearer, safer place to heal. And we recommend, looking at air purifiers that have a true HEPA filter to trap ultrafine particles and mold spores, an activated carbon filter to absorb VOCs and mycotoxins, and a sealed system that prevents air from bypassing the filters. Some of the top options that we suggest are IQ Air, Austin Air, Air Doctor, and Molecules that we have in our office. Molecule uses a different technology called PICO, which not only traps the problem, but it destroys the pollutants at a molecular level as well. Keep in mind, an air purifier can't fix a moldy building, but it can be a powerful tool to support recovery, especially if you're highly sensitive. Another really important thing to consider to prevent mold growth once you have taken care of it, or if you just want to prevent it altogether, is indoor humidity. This is an easy fix. Mold thrives in damp environments. Once humidity consistently climbs over 50%, you're creating the perfect conditions for mold and dust mites to grow, especially in basements, bathrooms, and poorly ventilated areas, which are the areas we have to worry about. Ideally, you want the indoor humidity in a range of 35 to 45. This is low enough to discourage mold, but still comfortable for living. If you're struggling with moisture, a quality dehumidifier can make a huge difference. They're not that expensive. And make sure it has a built-in hydrometer so we can tell, again, where the humidity is at. Run it during these times, like right now, where humidity is high, the warmer, wetter months. If you've got areas of condensation in the windows, musty smells, that's telling you that you got too much humidity. So make sure you prioritize keeping that humidity 35 to 45%. And like in our house, we've got a few of these guys running around because, one just won't take care of it. You got to look at the square footage and make sure it matches up. And then one of the things that's important to know is that sometimes getting out of the moldy environment or having it professionally cleaned is really all you need to do to recover, especially if the exposure was short-lived and the body is resilient. But more often than not, especially with the patients we see, especially the highly sensitive people, damage goes a little bit deeper, and we have to take a little bit of a different approach. Mycotoxins can trigger chronic inflammation, nervous system downregulation or dysregulation, immune dysfunction, impaired detoxification. And so for these patients, after an exposure ends, their body can stay stuck in a reactive, inflamed state. And that's why in many cases, we have to go beyond just fixing the environment. We have to address the internal terrain. If you've been exposed to mold or mycotoxin, detoxifying becomes an essential component, because detoxing or removing toxins is really what mold is all about, right? If you can't do that, that's where you get sick. And some people are just genetically susceptible where they can't remove toxins very well. They accumulate in fat tissue, they disrupt cellular function, they drive that chronic inflammatory response that creates all those symptoms. Supporting detox isn't about a trendy cleanse. It's about helping your body do what it was designed to do, but no longer can do effectively. Detox happens in 3 phases. That's what this picture shows us. Phase 1, the liver uses enzymes to convert toxins into intermediate compounds, and this step makes them water soluble, but it's not where it ends. This sometimes it creates actually more reactive byproducts. Phase 2, it takes these intermediates from phase 1 and then it neutralizes them by binding them to things like glutathione, sulfur, or amino acids so they can safely be excreted from the body. And then phase 3, which is the final step, is where the body eliminates the toxins through bile, urine, stool, sweat. And that's why bowel regularity, hydration, lymphatic drainage, and flow, these are all crucial steps in this process. If any of these phases is sluggish, toxins will recirculate or get stuck, especially in mold sensitive patients. So you have to take a comprehensive approach to detoxification. And honestly, it's different for everybody. Drainage is the concept of opening up the exits, right? This is where we have to work on bile flow, stool evacuation, urine, sweat, and lymph drainage. And there are so many strategies. I wanted to list a few here. But again, we use testing to help guide us to figure out where those weak spots are at. But some of these things are just generally good to do. Epsom salt baths, staying hydrated, electrolytes. There's, dry brushing, rebounding. And then again, there's some great herbs and nutrients to help with this as well. I'm a big fan of sauna, no matter what you're dealing with. And then another priority that often gets overlooked is the limbic system. The limbic system is a group of interconnected brain structures that help regulate your body's emotions and behavior. The structures of the limbic system work together with other brain regions by processing your memories, thoughts, and motivations, and then telling your body how to respond to them. The limbic system is one of the oldest structures in your brain. It produces natural instincts that your ancestors used to survive by triggering behaviors needed like eating and drinking, reproducing, caring for their young, and reacting to their surroundings. The fight or flight or sympathetic nervous system. This is a big part of the limbic system, and this is a big problem with people who have mycotoxin illness. In mold-sensitive individuals, the limbic system, that emotional response system, can become hypersensitive and overreactive, and then people get stuck in this high state of alarm. This can lead to symptoms of anxiety, panic, being sensitive to smells and chemicals, and a heightened response to even small exposures. This is not in your head. It's not a psychiatric issue. It is a real neurological response to a toxic insult. And that's why calming and retraining the limbic system is often an essential piece of the healing puzzle, not only with mold, but with autoimmunity, with chronic infections, with, fibromyalgia, with COVID injury. There's lots of things that we're seeing limbic system impairment related to it, and these strategies to heal them, which we'll talk about in a second, can be helpful. So when limbic system has been hijacked by chronic stress, toxins, illness, the list goes on and on, it can leave the body locked in a state of hypervigilance, which even after you remove the trigger. So this is something that's ongoing. And that's where limbic system retraining comes in. Programs like Primal Trust or DNRS, Dynamic Neural Retraining System, are designed to rewire the brain's stress response, calm down that nervous system, and shift the body out of fight or flight. These aren't just mindset tools. These are neuroplasticity-based programs that work with the level of the brain and the nervous system, helping to restore balance and reduce reactivity to mold, chemicals, foods, and much more. One of the biggest mistakes that I see in people is putting this step off in their journey because they say they don't have the time or they don't think it's a big issue. They prioritize all these other fancier strategies first, but it ends up getting them in trouble. This should be one of the first steps because a dysregulated nervous system will resist healing until it feels safe. And we see that where treatments that normally should help you will actually make things worse because your nervous system is working against you. I've seen it time and time again when patients commit to limbic system work early on, everything else starts to work better, from detox to sleep to immune dysregulation. Now, the vagus nerve, you probably have heard of this. This is a main contributor to the connection between the brain and the body. It regulates digestion, heart rate, inflammation, and your ability to relax. Chronic mold exposure and stress can suppress vagal tone, leading to things like poor digestion, increased inflammation, anxiety, poor stress resilience, brain fog, fatigue, all sorts of different things. You may, some red flags, if you have trouble swallowing pills, if you have trouble swallowing, if you have palpitations, if you're worked up all the time, those are red flags that, again, you might have some vagal nerve dysfunction. Now, limbic system overactivation, like we see with mold and with trauma, keeps this vagal nerve in a low tone survival mode. And this causes the body to get stuck in sympathetic or fight or flight dominance. Okay. So that's where, again, you're constantly on that, and in that alarm stage, constantly trying to run. And it's really difficult to heal when you're in that state. So restoring vagal tone is critical to healing, but it also helps with restoring immune balance, detoxing, and of course, the nervous system regulation. Common exercises for the vagus nerve include belly breathing, meditation, humming, gargling, coffee enemas, believe it or not, cold exposure, like splashing water in the face or taking cold showers or cold plunges. All those are really good for your vagus nerve. These are activities that activate that parasympathetic nervous system, trying to help, calm down that stress response. And there's also some new fancy devices out there you may have seen or heard of. Apollo Neuro, Gamma Core, we use that a lot. These are all gentle vibrations or electrical impulses that stimulate vagal tone, typically in the neck, to help, again, support nervous system regulation. These tools can be really helpful for individuals recovering from mold illness and chronic inflammation because they're promoting relaxation and resilience. Another crucial step to mold recovery is the process of using binders. Think of binders as Velcro for toxins. They attach to mold toxins in the gut. They help escort them safely out of the body. They prevent them from being reabsorbed or recirculated. The type of binder will depend on the mycotoxin that you are dealing with. Different binders have different affinities to different mycotoxins. So we personalize this part of your protocol based on your test results. As long as the exposure is no longer ongoing, binders can be one of the most effective tools to reduce your body's toxic burden and ease symptoms. Typically, re-implement a binder protocol for 3 to 4 months and then retest to see if things are getting better. It's a powerful tool. It's a powerful next step, but we have to introduce this very carefully because, believe it or not, just by adding in these binders, it can stir things up, especially in sensitive individuals, and make you feel worse. But it is a necessary step. Another hallmark, one of the hallmark symptoms of mold illness is that crushing fatigue. A lot of people are familiar with that, and it's for good reason, because mycotoxins directly impair mitochondrial function. And the mitochondria are the energy-producing engines inside your cells. They can damage mitochondrial membranes. Molds and mycotoxins will damage mitochondrial membranes. They'll block energy pathways and increase oxidative stress, leaving you with less fuel to function. And that is the symptom that many people are experiencing. This isn't just about being tired. It's about cellular energy crisis that affects your brain, your muscles, your digestion, and especially your ability to detoxify. So you got to support your mitochondria. How do you do that? Well, to effectively support your mitochondria and recovery, we need to know where your system is breaking down. And that's where testing comes in. If you're a patient, you've seen this test before. This is the metabolomics. It's probably one of my favorite tests. It's a urine test that gives us a deeper insight into your mitochondrial markers, your nutrient status, your oxidative stress, your detox pathways, and much more. It helps us identify functional deficiencies and key nutrients, the need for key nutrients like carnitine, CoQ10, magnesium, B12, B9, all of the B vitamins. By doing this, we can customize support that's unique to you. It's not a catch-all, one size fits all. We need to be strategic and build it around your results in your body because that's where you're going to feel the best. In some cases, especially when symptoms persist despite leaving a moldy environment, we have to consider fungal colonization, particularly in the sinuses and the gut and in the lungs. This is where targeted antifungal therapies can make a big difference. We may use herbal antifungals like oregano oil, garlic, berberine, caprylic acid, or we may use prescription agents like nystatin, fluconazole, itraconazole. And a lot of times too, we'll use nasal sprays to help with that sinus colonization. So these guys can be anywhere. All of the microbiomes in our body are connected. You have a sinus biome, you have a skin biome, you have a vaginal biome for women, you have the gut biome, obviously. You've got lung biome. These biomes are vast and they're all communicating with one another. And if you have mycotoxin illness, a lot of times, again, they will be dysfunctional. We have to address that. And sometimes that's where these antifungals come into play. So if you've started a detox, or whether it's the binders or the antifungals and you feel worse, you're not alone. And you're not necessarily going backwards either. You may be experiencing what's called a Herxheimer reaction, or a Herx, or a die-off reaction for short. This happens when your body starts killing off mold or fungi or mobilizing toxins faster than you can eliminate. The result, a temporary flare of symptoms, like you might see a worsening of fatigue, headaches, brain fog, joint pain, or mood changes. This isn't a sign that the treatment is bad for you. It actually can be a sign that something good is happening. It just means that, again, your body's not offloading it fast enough. So when we have a Herx reaction, we sometimes will slow down the protocol. We're going to really put more of an emphasis on things like the drainage, binders, hydration, bowel regularity, sauna, lymphatic support, and of course that nervous system regulation. It's important to listen to your body. Healing isn't always linear, but when we approach this step in a way that is very meticulous and strategized, you're going to see the best results. It just takes time, and it is a roller coaster sometimes. Another advanced therapy that can be incredibly helpful for patients recovering from mold illness and chronic infections is ozone therapy, IV ozone. If you're not familiar with this, it's a really cool therapy. It doesn't get enough credit. Everybody thinks of ozone as, what's in the air and is bad for us. But again, IV ozone, which is essentially just 3 oxygen molecules, can be very, very beneficial. Ozone is a highly oxygenated molecule that, when administered correctly, has potent anti-inflammatory, antimicrobial, and detox supporting properties. In mold illness specifically, IV ozone can modulate the immune system, reduce systemic inflammation, support mitochondrial function, and enhance oxygen delivery and cellular energy. It also has the ability to target self-infections and improve circulation. Now, it's not a standalone solution. Nothing ever is. But when you use ozone in conjunction with all of these other therapies, it can be a powerful catalyst for healing, especially in complex or resistant cases. I do ozone myself. I think it's awesome. Hyperbaric's another great tool. If you haven't heard of hyperbaric oxygen therapy, or HBOT, it's another therapy where we're using oxygen for healing. Hyperbaric involves breathing high concentrations of oxygen in a pressurized chamber, which significantly increases oxygen delivery to the tissues throughout the body. For patients recovering from mold exposure, hyperbaric oxygen can help support mitochondrial function and ATP, reduce inflammation and oxidative stress, enhance detox and tissue repair, and improve brain fog, fatigue, and neurological symptoms. It also supports the body's ability to heal by stimulating stem cells. Stem cells are getting a lot of attention these days, and for very good reason. If you use hyperbaric, we know that actually can help stimulate stem cells, which are can be compromised in mold illness. And then we've got the concept of co-infections. Okay, one of the reasons mold illness can be so complex is because it rarely shows up alone. Many patients are dealing with chronic mold exposure. They also have stealth infections that can further suppress their immune system. They can be Lyme disease, Bartonella, Babesia, chronic viruses like Epstein-Barr, Candida, parasites, or COVID. I am convinced that a lot of the long COVID stuff that we're seeing is actually a reactivation of other issues that the body was at one time dealing with. So you get COVID or you get the vaccine, your immune system gets suppressed, and then that lets these other dormant bugs just flourish. And that's where a lot of people become sick. So if we address those co-infections, people with long COVID, that's where a lot of people see improvement. But if we only focus on mold and we ignore all of the other layers, people are not going to recover as well as they should. And that's why, in functional medicine, we really look at that comprehensive approach, trying to address and investigate all of the potential factors. Now, you're not going to find everything and you don't need to, but if you get enough of these bugs and toxins down and you get the immune system working efficiently, the body can handle quite a load. It's a beautiful thing. A healthy recovery from mold illness isn't just about detox. It's also about rebuilding what's been damaged. And one of the most critical systems to restore is the gut microbiome. And I know many of you are familiar with that. Mycotoxins and antifungal therapies and just the stress of the nervous system regulation will impact the gut bacteria, leading to dysbiosis, leaky gut, and microbial diversity problems. Okay, this weakens your immune system further and further impairs detox and increases inflammation. Remember, 70 to 80% of your immune system is in the gut. And many detox processes like binding and elimination of toxins are dependent on the integrity of a healthy gut and a sufficient amount of beneficial bacteria. So rebuilding the microbiome involves more than just taking a probiotic. We take a top-down approach. We focus on removing gut irritants, replenishing with targeted strains of probiotics, using prebiotics and resistant starches, polyphenols, fermented foods, the right stomach acid, digestive enzymes. The list goes on and on. It is a very comprehensive process, and that's where we use testing again to guide us. Repairing the microbiome is a foundational part of restoring balance to the immune system and detox pathways. And ultimately, this is what builds long-term resilience. And that's what we're after, because realistically, if you're sensitive to mold, you're going to get exposed again. But if you get your body strong enough, it's not going to be as big of an issue. Mold and mycotoxins don't just affect your immune system and don't just affect your gut. They also disrupt your hormones as well. Many patients exposed to mold experience imbalances in sex hormones like estrogen, progesterone, testosterone. They have adrenal hormone imbalances with cortisol and DHA, and they even have thyroid imbalances. Chronic inflammation, toxicity, and stress from mold exposure can suppress the hypothalamic pituitary axis, the HP axis, leading to symptoms of fatigue, low libido, mood issues, weight gain, menstrual irregularities, temperature intolerance, and so much more. Supporting and testing your hormone levels is essential, especially during recovery. This isn't something you have to do at the end. You're doing it simultaneously with everything else. Even though I'm presenting this in an order, we're working on all this simultaneously because you have to. We often see low cortisol in the morning, flattened cortisol curves, or sluggish thyroid function. And for women, again, we'll see like no testosterone, no sex hormones, which leads to other problems. And down the road is not great for your bones or your brain or anything else. So rebalancing hormones might involve adaptogens. Sometimes we'll use bioidentical hormones or targeted nutritional support. And then, of course, removing the underlying stressors. Hormones are messengers, and when they're out of sync, the whole system suffers. So bringing them back into balance and restoring vitality is absolutely essential in the journey. So if there's one thing I want you to walk away with from this talk, it's this: healing is possible, but it takes time, and it takes patience, and it takes commitment. Mold recovery isn't a quick fix. It's not a one and done protocol. It requires a full lifestyle shift, rethinking your environment, supporting your nervous system, and staying consistent with the tools that work for your body. If you got well doing specific things, continue to do those things so you stay well, or else oftentimes you will relapse. The process can feel overwhelming in the beginning, but I promise you it does get easier. Your body was designed to heal. It's a beautiful thing. When you remove the obstacles and you give it the right support, it will respond. And there is nothing more valuable than your health. When you reclaim it, everything else in life improves: your energy, your focus, your relationships, and your ability to show up. And as you move forward, remember these core principles: nervous system first, calm the alarm, create safety. Environment is everything. You can't heal in a toxic space. Drainage before detox. You need to open up the exits before you turn on the faucet. Go low and slow. Less is often more, especially if you're sensitive. And you got to have personalized protocols. You got to retest, and you got to adjust your plan as your body and your environment changes. Healing isn't always linear, and sometimes that is really frustrating for people to hear and to experience, but it is possible, and it's worth every step.